Hello. In this lecture, we will be continuing our discussion of the digenetic trematodes. I want to begin by touching base with you again on schistosomiasis and mentioning a couple of important ongoing control programs that are occurring. We referenced one of these programs in the article that I gave you to read. This particular control program was focused on schistosomiasis japonicum and the efforts that are being made in the Philippines to try to control the disease there. There are initiatives that are also ongoing with the Carter Center, and I'm going to click on this video here for a short introduction to their schistosomiasis efforts.
In a dam near their village, children found refuge from the sweltering African heat. But in this water, they're exposed to a parasitic disease that can cause bleeding and severe organ damage. Urinary schistosomiasis, caused by worms, hosted by a snail.
So what happens is the children urinate in the water, and in their urine are eggs. The eggs hatch, and they infect the snail. In the snail, they develop into the form that can infect humans. It actually penetrates the skin and sets up shop in the human. The female worms produce eggs. It's essentially thousands and thousands of eggs working their way out of the body, through the bladder, into the urine. They cause bleeding, and that's why the manifestation of the disease is blood and urine.
This disease can stunt a child's growth and impair learning. Young victims are more vulnerable to other infections like malaria and tuberculosis. Schistosomiasis is rampant in Africa's rural areas with little or no access to safe water, but it's largely neglected. In Nigeria, an estimated 16 million children are infected. Hundreds of millions of people in 74 countries are victims of this disease, despite the availability of an inexpensive cure, a drug called praziquantel that costs only 20 cents per treatment, taken orally once a year.
This medicine, when provided once a year, particularly aimed at school children, dramatically reduces the blood in the urine that the children have as a result of the infection. So we've seen a decrease from over 50% of children having blood in their urine to now less than 5%.
Once treated, children are more alert in the classroom and score better on tests. They grow taller and gain weight, an opportunity all children deserve. But while schistosomiasis can be controlled, treatment and health education must continue, as reinfection easily occurs. Since 1999, the Carter Center has worked with the Nigerian government to reduce the prevalence of schistosomiasis by providing health education and single annual doses of praziquantel to communities with the highest rates of infection.
1.5.
It's the largest initiative treating this disease in Africa's most populous nation.
And then these children will all get praziquantel this week, and we hope that we'll be able to increase the administration of this medicine. The unfortunate part is that we can't get free praziquantel. On an average sized person, it costs about 20 cents. It doesn't seem like 20 cents is all that much, but to raise enough money to treat, millions of people, it takes a lot of contribution from donors.
The Nigerian program can now buy only a fraction of the praziquantel needed here, but its successful efforts provide hundreds of thousands of children an opportunity to thrive.
All right, so since the time that the Carter Center started their initiative, and they did get some assistance eventually from the manufacturer of praziquantel, the Bill and Melinda Gates Foundation has also come on board, and they are funding an initiative known as SCORE, which is the acronym for Schistosomiasis Consortium for Operational Research and Evaluation. This SCORE project, which has been going on for a few years now, is predominantly focused on drug administration, massive drug administration in endemic areas. They're focusing on schistosomiasis caused by Schistosoma hematobium and schistosomiasis caused by Schistosoma mansoni. Since the initial program began, the manufacturer of praziquantel is actually agreed to open a factory in England, and the only purpose of that facility is to synthesize praziquantel. So that's a big boost to this initiative. In addition to praziquantel administration, they're also working on more rapid and improved diagnosis, because the Cato cat's fecal exam is pretty time-consuming, laborious, not 100% as we saw in the research article, and then also snail control. The director of the SCORE project is Dr. Daniel Cawley, who is the director of the University of Georgia Center for Tropical and Emerging Diseases. So moving on to some other important digenetic trematodes that cause disease in humans, we're going to first move on to Fasciola hepatica. Fasciola hepatica is in the family Fasciolidae, and the members of this trematode group are very large and apparent. And I think that's one of the reasons why Fasciola hepatica was actually the first digenetic trematode life cycle that was worked out. So these are, I said, large leaf-shaped trematodes. And another characteristic is the acetabulum, which is the other name for the ventral sucker, is actually quite close to the oral sucker. So Fasciola hepatica is known as the sheep liver fluke, and it causes the disease known as fascioliasis in humans. It also causes disease in sheep and cattle and other grazing mammals worldwide, and actually has a big impact on the sheep and cattle industry because of losses, economic losses due to infection. As I said, the size is quite large, and it can reach up to 30 millimeters in length. This next slide shows some images. So this first slide on the left is the adult fluke or adult trematode. And you can see it is rather leaf-shaped. And a couple of features here that are important is that there is this structure here, just the anterior portion of the worm here. And this is known as a cephalic cone because it does form sort of a cone shape. And then you notice these sort of shoulders out to the edge. So there, as we're going to see, there are similar species of trematode that superficially resembles this, but there's some important differences. You can also see that the acetabulum, which is the ventral sucker, is way up here and not too far from the oral sucker. And the other thing that's really obvious too is this highly branching digestive tract. There's highly branching uterus, and even the testes are branching. So you see a lot of this sort of dendritic looking structure inside the adult worm. Now the life cycle of Fasciola hepatica includes an egg stage, which you can see here. The egg is broadly oval, and it does have an operculum. Sometimes it's hard to see the operculum, but it's a thin operculum that does open to release the miracidial stage. And the miracidium of Fasciola hepatica looks quite similar to the miracidia of other digenetic trematodes, such as the schistosomes that we just studied. It also takes on this sort of brownish yellow tint and is very noticeable because of its rather large size. This is the cercarial stage here. So snails do release cercaria into the water column, and you can see there's a single tail, and this is just a classic simple leptocercus tail, and you can see that the cercaria actually shows an oral and ventral sucker. So these swim in the water, and in the case of Fasciola hepatica, the cercaria actually come in contact with aquatic vegetation, like watercress or other aquatic plants in fresh water. And when they attach to the plant material, they transform into the metacercarial stage. So the metacercaria is actually in the environment and attached to aquatic plants. Inside the metacercaria, which has a very thick protective cyst wall, you can see larvae developing inside. So the larval stage, the larval trematode is developing in sort of this quiescent stage, waiting for a proper definitive host to come along and ingest it. So just to review then, the adult worm is leaf-shaped. It's pointed posteriorly and wide up at the anterior end, forming almost shoulder-looking structures. The ceca are highly dendritic and the testes are highly dendritic. The egg is large and oval, operculate, and yellowish-brown. And the adult worms live in the bile passages of the liver. So here is the life cycle, and we'll begin with an infected sheep. The sheep is harboring these adult worms in the bile passages of the liver, and the bile passages, the bile ducts, actually empty into the small intestine. So it's a natural route for the eggs to follow when they're released. So the eggs enter the intestine and they're released in the feces. Inside the egg, the miracidium is developing, and in the water, the operculum opens, the miracidium comes out, finds an appropriate snail host, penetrates the snail, and inside the snail transforms into the sporocyst stage, and then from the sporocyst into a mother and daughter rhedia generation. And in the daughter rhedia, the cercaria develop, and then the cercaria are released from the snail into the water column. And the cercaria swim until they come in contact with aquatic vegetation, where they form metacercaria. And then the metacercaria are basically waiting until an appropriate definitive host comes along, like a sheep or a cow, and ingests the metacercaria stage. Once swallowed, the metacercaria pass through the stomach. The larval trematode comes out and migrates. There is actually a pretty extensive migration of the fluke. It migrates right out of the intestine and creeps along the viscera and keeps searching, migrating until it comes to the liver. And then the larvae actually penetrate right into the liver, and they end up inside bile ducts. So naturally, this migration, this passage of the larvae, is going to create some destruction along the way. And so some of the pathology is associated with that migration. Humans come into play here when they accidentally ingest the metacercaria when they eat aquatic vegetation. One of the most common culprits in the human life cycle aspect is the ingestion of watercress that contains metacercaria. So a little bit more about this migration. So even though the metacercaria actually exists, unless the juvenile out in the small intestine, the juveniles do have to go through this migratory route to find their way to the bile ducts. So they penetrate the intestinal wall, they enter the body cavity, they migrate along the viscera until they reach the capsule of the liver. They burrow into the liver, they're feeding, they're growing, they enter the bile ducts, and that's where they become sexually mature and start to produce eggs. So these are monoecious individual worms where they have both male and female reproductive structures, although, as with other trematodes, they can practice cross-fertilization between two monoecious individuals. So the disease in humans is known as fascioliasis, and as I indicated previously, people become infected when they ingest watercress or other forms of aquatic vegetation with metacercaria. People with this infection, their pathology varies depending on how many metacercaria they swallow. If there are enough juveniles migrating, you can get some pretty significant damage to the liver and some necrosis or tissue death and some tissue scarring, fibrosis. And if there is significant damage, the liver has a rich vasculature, and so you can have a lot of bleeding that results. And sometimes people become anemic if they have heavy infections. So that's due to some bleeding based on the migration, but it's also because the sheep liver fluke feeds on blood as well as on liver cells and tissue. So you're going to have inflammation, you're going to have edema, and the inflammation that it builds up around the bile ducts causes thickening and fibrosis of the bile ducts, leading to that condition known as pipe stem fibrosis. So basically the bile ducts have this leukocyte infiltration that causes this thickening of the bile duct wall, and as the wall of the duct thickens, the diameter of the bile duct shrinks and eventually can occlude, which can cause blockage and buildup of bile. There's also erosion of the walls of the bile ducts. Eventually, all this damage results in cirrhosis or scarring of the liver. And there are also some situations where these juvenile flukes get lost on their way to the liver, and they can end up in ectopic locations like the eyes, brain, skin, and lungs. It is pretty much always the case when you have a trematode that is in contact with your tissues, and especially a migrating trematode like this one, eosinophil levels are going to increase in the bloodstream. Some epidemiological considerations. Fascioliasis is going to occur where cattle and sheep are raised, and it is most common in Europe, Northern Africa, Cuba, South America, and the U.S. It's not extremely common in humans, but it does occur with some frequency. In practice, if you have a patient that's experiencing liver blockage and a loss of liver function, and they have a history of eating watercress, then fascioliasis should at least be expected, especially if they have eosinophilia. Now, fascioliasis is also of a big veterinary concern, and like I said, it can result in economic losses and a failure to thrive in animals that are infected, in addition to pretty extensive liver damage to these animals. And a fairly recent study in Montana actually showed that 70% of cattle livers were infected with this parasite. So it is still fairly common, even in the U.S. So diagnosis would be based on finding the eggs in a stool sample. And in terms of both humans and domesticated animals, early diagnosis is important to prevent extensive liver damage. Unfortunately, praziquantel is not effective against Fasciola hepatica. It's one of the few trematodes that do not respond to praziquantel. The drug of choice is triclobendazole. Triclobendazole, albendazole, mebendazole are all classically anti-nematode roundworm drugs, but they do seem to have an effect against Fasciola hepatica as well. Some of these flukes are actually removed surgically, and I'm not going to play it during the lecture, but you can play this click on your own, this link that shows the surgical removal of one of these quite large flukes from a patient's liver. The next parasite is called Fasciolopsis buscae, and as you can see, at least superficially, it resembles Fasciola hepatica. It's quite large and leaf-shaped. Notice the absence of the cephalic cone and the lack of those shoulders. The Fasciolopsis buscae adults actually can get larger even than Fasciola hepatica, so it's known as the largest Digenean trematode. This is a parasite that actually resides in the intestines, and it occurs in Asia and India most frequently, and is associated with the raising of pigs. So I have a CDC life cycle on the next slide, And if we follow along here, we can see that Fasciolopsis buscae is in the small intestine, so that's where the adults are. And the feces are naturally going to be released into the intestine and out with feces. The egg of Fasciolopsis looks nearly identical to that of Fasciola, so you'd have to use molecular techniques to tell the difference from the eggs. The eggs are in the water and they hatch, so the operculum opens, out comes the miracidium infects the snails. The snail host then provides the environment for the sporocyst to rhedia transformation, and then inside rhedia you have cercaria developing. Cercaria are released into the water column, and once again, very similar to Fasciola hepatica, the metacercaria form on aquatic vegetation. So you don't have a second intermediate host, and instead the metacercaria form on aquatic vegetation. Now, this parasite occurs, as we said, in Asia and India, and some of the forms of vascular plants that it affects are plants like water chestnuts and water bamboo, and some of the more common aquatic plants that are used in Asian dishes. The key, though, is that these items are ingested without cooking. So when the individual swallows the plant that contains the metacercaria, the embryo hatches, and in the small intestine, it develops into the adult stage to complete the life cycle. So just to review then, the adult Fasciolopsis buscae lives in the small intestine. It's similar to Fasciola hepatica, but actually larger, and there are some diagnostic differences. For instance, its digestive ceci are not branched, and the ventral sucker is actually larger than the oral sucker, but they are still quite close together. There's also no cephalic cone and no shoulder. In terms of pathology, these large digenetic trematodes are actually feeding on intestinal contents and on the superficial mucosa. So there is some inflammation, some ulceration of the mucosal lining because of their feeding activity. And you can also have abscesses forming where these worms are attached. There are also commonly symptoms such as diarrhea, nausea, intestinal pain, especially in the early hours of the morning. But intestinal obstruction would occur only in the most severe cases where you have very heavy worm burdens. Some epidemiological considerations. This parasite infects both pigs and humans, so pigs can also serve as definitive host. Pigs can harbor the worms in their intestine and therefore would represent a reservoir host for this infection. The most common areas for this disease are Central and South China, Taiwan, Thailand, Laos, Vietnam, Cambodia, Korea, Indonesia, and India. Some of the factors, behaviors that enhance transmission are when people grow aquatic plants in ponds that have been fertilized with pig feces or human feces. And this is not uncommon. So especially if you have aquaculture occurring, sometimes people do use pig feces or human feces as a fertilizer in the aquaculture system. And then, of course, to complete the cycle, humans have to eat that aquatic vegetation uncooked. Triclobendazole is the drug of choice for Fasciolopsis buscae, as it is for Fasciolopsis or Fasciola hepatica. All right, the next digenetic trematode on our list is the Chinese liver fluke, which is in the family Opisthlorchiidae. Clinorchus sinensis, or the Chinese liver fluke, is a fluke that lives in the bile ducts of the liver, so it has a similar habitat In its adult stage is Fasciola hepatica. The disease is known as clonorchiasis. It occurs in China, Korea, Japan, Taiwan, and Vietnam. This first image here just actually shows about the anterior half of the worm. So you can see it's rather long and slender. It has the oral sucker here, the ventral sucker here. You can see that the digestive tract is rather simple and tubular, so you have the esophagus and then the branch ceca going all the way down the length of the worm. There are vitellaria, yolk glands out on the lateral sides of the worm, and in the middle here you can see the uterus. And if this was higher magnification, you could probably see the egg stage inside the uterus. So the egg is actually a fairly small operculated egg, and it resembles a little light bulb in fecal smears. This is just a second image of Clonorchis sinensis showing the entire worm. You can see some of the other internal features, like these two testes that are dendritic in appearance and occur one after the other. And here you can more clearly see the ventral sucker and the oral sucker. All right, so these adult worms are tapered anteriorly with a posterior end that's more blunt. They're long and slender. They have a somewhat poorly developed ventral sucker, and again, it's about 1/4 of the body length from the anterior end. The eggs are small, light brown, operculated, and there is that little ridge or collar at the base of the operculum that sort of gives these little eggs the appearance of a little light bulb. All right, so the life cycle works like this. Keep in mind the adult worms here are in the bile ducts of the liver, and the bile empties into the intestine, the small intestine, and then the embryonated eggs are released in feces into the water. In this case, there's an interesting little twist in which the Miracidia does not hatch out in the water. It's kind of strange. Instead, the snail has to actually eat the egg. So the Miracidia is still inside, the operculum is still intact, and then the snail ingests the egg. Now, once the egg is inside the tissue of the snail, the operculum opens and the Miracidium comes out. It rapidly, though, loses its cilia and forms the sporocyst stage. So inside the snail, you have Miracidia, sporocyst, rhedia, and then the rhedia produce the cercaria. The cercaria are released into the water, and these free-swimming cercaria then look for the second intermediate host in the life cycle, which is a fish. So in this life cycle, the cercaria attach and penetrate the skin of a fish, and once they enter the flesh of the fish or the skin, they form the metacercarial stage. So these metacercaria then are present in the flesh of the fish, sometimes out in the skin. If you've ever caught a freshwater fish and noticed that it had black specks on the skin, it might very well have been a fish that was infected with a digenetic trematode, and what you're seeing are melanized metacercaria. Now, Clonorchis sinensis does not occur in the U.S., so you're not seeing Clonorchis sinensis, but you're seeing metacercaria of some other digenetic trematode that uses a fish as a second intermediate host. Now, of course, people are going to come into the life cycle when they eat this fish either raw, smoked, pickled, or undercooked, in which case the metacercaria are still viable. The metacercaria are swallowed, ingested, and they, the larvae exist in the small intestine, and then they migrate to end up in the bile ducts of the liver. So the disease that's caused by Clonorchis sinensis is known as clonorchiasis, and the presence of these worms, not surprisingly, causes both mechanical and toxic damage to the bile ducts as they feed and metabolize. And if there are a lot of worms present, once again, you have a direct correlation between the degree of pathology and the number of worms. The record number of worms ever recovered from one patient by surgery was apparently 21,000 adults in one patient. So, along with the mechanical and toxic damage to the bile ducts, which results in thickening of the bile ducts and heavy leukocyte infiltration, and again, as that bile duct wall becomes scarred and thick and fibrotic, you have pipe stem fibrosis, and the diameter of the ducts become smaller and smaller until they're obstructed and bile cannot leave the liver. You can have hepatomegaly or enlargement of the liver, cirrhosis. And the good news is that the migration of these larval trematodes as they go from the duodenum into the liver is less invasive. So they're not like the larvae of fasciola that have to physically bore their way through the liver. So they don't tend to cause as much liver damage, at least in the migration phase. Like other tissue-dwelling helminths, eosinophilia is going to accompany these liver symptoms. Epidemiological considerations. As we've indicated, humans are infected when they eat raw or poorly cooked fish. Steamed fish, pickled fish, and smoked fish also carry live metacercaria. You have to cook fish in order to kill the metacercaria. As the eating of raw fish has become more popular throughout the world because of the popularity of sushi and sashimi, and the increased popularity of freshwater fish farming, in some areas of the world, chlorhydriasis has been increasing. Some factors that help to contribute, we saw this earlier with Fasciolopsis buscae. The use of human feces as fertilizer in aquaculture is of concern in some endemic areas. There are some regions that have very high prevalence, so Hong Kong has a prevalence of about 14%. In some rural areas of Asia, up to 80% of people are infected. And it turns out that there are some reservoir hosts that can play a role in this life cycle. Cats and dogs, minks, badgers, just depends on the region. So reservoir hosts can also contribute and keep this parasite cycle going, even if you break customs like using human feces in aquaculture. The diagnosis is pretty readily made by finding the characteristic eggs and feces along with the other characteristic liver maladies. And praziquantel is the drug of choice for clonarchiasis. All right, so now onto the family Troglotrematidae and the parasite known as Paragonymous westermanni. Paragonymous westermanni is the oriental lung fluke. And here you can just see a couple of images associated with this species. So here's the egg. The egg of Paragonymous westermanni is intermediate in size between the very small Clonarchus sinensis and the large egg of Fasciola hepatica. It does have an operculum, which you can see here. And one of the characteristics of these eggs is that the operculum is rather flat. And it tends to be more slender and more elongate than either Fasciola or Clonarchus. In this life cycle, crabs and other crustacea like crayfish and prawns can serve as intermediate hosts. Here in this slide, you can see a stained image of a preserved adult trematode, and you can see that it takes up stain really nicely. They actually make a very pretty specimen. This is the anterior end here. This ribbon-looking structure here, these are digestive ceca, and these are vitellaria out to the outer lateral edges. Over here you can see a classic metacercarial stage of Paragonymous. In the next slide, you can see the geographic distribution. So this is known as the Oriental lung fluke. And so it does have a higher prevalence in the Orient. And you can see both India and sort of Southeast Asia are areas where there are still quite a lot of infection. There are some other foci in Africa and even over here in South America. An interesting attribute of Paragonymous westermanni is that the adults are found encapsulated in the bronchioles of the lungs. So it's called the Oriental lung fluke because that's where the adult stages live. And what's unusual is that two adults tend to pair and be encapsulated together. So it's really kind of common to open up a capsule and see two adults together. No, they are monoecious, so it's just two monoecious individuals, but presumably they pair up this way for cross-fertilization, and then they get encapsulated by the host immune response. In the life cycle of Paragonymous westermanni, the cercarial stage is the microcircus. If you remember, those cercaria have a very small tail, and they also have a stylet that extends from the anterior portion of the cercaria, and that's going to help them get into their intermediate hosts, the crustacea like crabs and crayfish. If you recall from the picture of the egg, it's brownish, operculated, smaller than Fasciola hepatica, but maybe somewhat similar in appearance. It does have sort of a flatter operculum. All right, so a look at the life cycle then. So remember that we have the adult worms in the lungs and the bronchioles encapsulated. And the adults then are releasing eggs into the lungs. So the eggs are going to be in the mucus that is coughed up by this person. And if the person coughs up and spits out, the eggs are going to end up in the water directly. The other thing that can happen is that the person can cough up the mucus and then swallow it. And when that happens, the eggs pass right on through and are released with feces. So you can find the eggs in feces. You can also find the eggs in sputum, and that's going to be important in the diagnosis. Once in the water, the eggs, the operculum opens and the merocydia hatches out and swims, finds a snail host, and then you have sporocyst, Redia generations, cercaria. Here's the microcircus cercaria. You can see the little bitty tail and the little stylet. So this is the anterior end and this is the posterior end. The cercaria then swim until they find a prawn or a crayfish or a crab, and they enter the tissues of the crustacean and form the metacercarial stage. And then the person becomes infected when they eat inadequately cooked or raw or pickled or steamed or smoked crustaceans that contain the metacercarial stage. When the metacercaria are swallowed, they're going to exist in the duodenum, and then they're going to have to migrate to find their way into the lungs to form the adult stages. All right, so just to review then, the adult worms are encapsulated typically in pairs in the bronchioles of the lungs. The encapsulation is caused by leukocyte infiltration followed by a buildup of fibrotic tissue. Eggs are coughed up and expelled with sputum, or coughed up, swallowed, and released in feces. Snails are the first intermediate host. Snails release cercariae, microcircus cercaria, that creep along solid surfaces in the water until they encounter a suitable crayfish or crab. That's one of the things I forgot to mention in the life cycle. That little tail does not allow them to swim in the water column, and instead they just sort of creep along the substrate of the water, along rocks and along the bottom, until they find crabs or crayfish or prawns that are foraging down in that region. The metacardial stages insist in the muscle tissues, gills, or viscera of the crustacea, and then the carnivore becomes infected when they eat the undercooked crustacea. The disease is called paragonomyosis, and as we've already stated, the adults and eggs actually get trapped up in lung tissue in capsules. You do get granulomas forming, and the capsules appear sort of brownish bluish in color, and they're going to contain, again, both adult flukes and eggs, as well as infiltrating leukocytes, and it forms sort of a semi-fluid mass around these little foci of infection. Because the flukes have to migrate, remember when the metacardia are swallowed, they come out, the larvae come out in the small intestine, they have to migrate, and they can end up in ectopic sites in addition to their normal site, which is the lung. And so if the larvae end up in other tissues and other organs, they can cause problems elsewhere. There is a very characteristic cough associated with paragonomyosis, and when the people cough up, it's often their sputum is blood tinged because of the damage to the lungs, but also there are often brownish streaks in the sputum, and that's because of the high concentration of paragonomous eggs. So if you were to actually examine the sputum, specifically those brown streaks, you would see a rich supply of paragonomous eggs. Individuals typically experience pulmonary pain, cough. Pleurisy is also a complication. Pleurisy refers to inflammation of the pleural membrane that surrounds the pleural cavity. There can be difficulties in breathing, low-grade fever, and again, this is a tissue-dwelling parasite, so eosinophilia is also a characteristic. Paragonomyosis has a worldwide distribution, although spotty in South America and Africa. Most infections are in the Orient. Humans become infected when they eat raw or undercooked crab, prawns, and crayfish. Again, pickling and smoking and even soaking in alcohol doesn't kill the metacardia. So there are some cultural practices that can enhance transmission. So apparently in some areas of the Orient, a delicacy known as drunken crab is popular, where raw crab meat is soaked in alcohol and then consumed at drinking parties. In some Oriental cultures, women believe that eating raw crab will make them more fertile, and if you eat raw crab, you're going to increase your likelihood of ingesting metacardia. And there are also areas in which the juice of crushed raw crabs is used for medicinal purposes. All of these are behavioral, cultural practices that can enhance transmission. The eggs are identified in sputum or feces, and the treatment is praziquantel. That concludes our discussion of the digenetic trematodes, and in the next section of lecture, we will be talking about the cestodes or tapeworms.